From VOA Learning English, this is the Health Report. Researchers say an experimental vaccine has shown to be highly effective at preventing the deadly disease Ebola. The World Health Organization says that the vaccine has been 100% effective at tests performed in Guinea. The British medical journal Lancet has published early test results and analyses of the findings. Norway's foreign minister praised the effectiveness of the new vaccine, calling it the silver bullet against Ebola. Norway is one of the several countries involved in the testing. Ebola spread through West Africa last year. The disease killed more than 11,000 people, most of them in Liberia, Guinea, and Sierra Leone. Ebola is one of a number of highly dangerous viruses known as hemorrhagic fevers. They can affect many organs, damage blood vessels, and affect the body's ability to fight infection. There are hopes the new vaccine may be a success in fighting against all such diseases. The vaccine is known as VSV-EBOV. Beginning in March, it was tested on more than 4,000 people in Guinea. All of them had come into close contact with the Ebola virus. WHO officials said early results were so promising that everyone at risk received the vaccine immediately. The WHO's General Director, Margaret Chan, told reporters that scientists, doctors, and drug companies worked together on the vaccine. If proven effective, she said the vaccine is going to be a game changer. She said it will affect efforts to control the current Ebola outbreak and future outbreaks. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Midwives help women have natural childbirths at home and in medical centers. A group of midwives in Los Angeles, California, is trying to train more minority women. They also want more women to give birth at home. Only 1% of babies in the United States are born at home. However, interest in home deliveries is on the rise. In Los Angeles, for example, some women are choosing to use midwives instead of the usual hospital birth with a doctor. Midwives are specially educated in childbirth services. They begin as apprentices or students. Then they must pass state tests called medical boards. In 2012, Jasmine Lavender delivered her second child in a bathtub. She chose birth with a midwife because she did not want to repeat the hospital experience she had with her first child. Doctors delivered that baby by operating on Ms. Lavender. The surgery is called a cesarean section. Ms. Lavender says the operation was unneeded and hurried. She says she felt she was not given enough time to deliver her baby vaginally. Ms. Lavender's second baby arrived without a C-section at the Community Birth Center in South Los Angeles. Licensed midwife Racha Lawler established the center. Ms. Lawler says it offers general health services such as testing for sexually transmitted diseases or STDs. When the center first opened, there were about 300 licensed midwives in California. Most of them were white. But Racha Lawler wants to increase by 100% the number of midwives of color. She hopes to do this through community outreach and free help for students. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. A World Health Organization official says a new form of avian influenza is unusually dangerous for people. Keiji Fukuda is the WHO's Assistant Director General for Health Security and Environment. He spoke to reporters in Beijing recently about the H7N9 bird flu virus. As of late April, the virus had killed more than 20 people on the Chinese mainland. The country had recorded more than 120 cases of the disease. The WHO sent a team of specialists to China to learn more about the H7N9 virus. Dr. Fukuda said there is still not enough evidence to show it can spread easily from person to person. He said evidence suggests that the virus is more easily transmitted from birds to humans than the last version of the virus, H5N1. That strain first appeared in 2003. Over the past 10 years, it spread from Asia to other areas. It has killed more than half of the 622 people it has infected. WHO and Chinese officials say the effort to understand the new virus is still at the beginning. Chinese and WHO scientists say birds infected by the H7N9 virus are the likely causes of human infection. Most of these birds are poultry, like chickens. The majority of deaths and infections from the virus have been reported in Shanghai. Officials there and in other cities have closed down markets where live poultry is sold. Chinese officials say more than half of those infected have been individuals who had direct contact with poultry or other birds. How the other people became infected with the virus is unclear. The government has carried out thousands of tests on birds, but only a small percentage were infected. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. Researchers have developed a medical device which they say can recognize malaria infections in the human body. The laser beam scanner is said to be the first device to identify the disease without a blood test. The test is painless, does not require blood from the sick person, and appears to be correct every time. At present, doctors use costly equipment to test for malaria. The new test only needs a person to place a finger on the laser device. Dr. Dmitry Lopatko is with Rice University in Houston, Texas. He says the scanner works by shining a very short pulse of light through the skin. The light comes from a low-powered laser. It shines on a very small particle called the hemozoan. The malaria parasite produces hemozoan when it infects red blood cells. Hemozoan crystals are not found in blood cells that are free of the disease. As the laser heats the crystals, they create small bubbles inside infected cells. Dr. Lopatko says the bubbles explode, making a sound that scientists can hear and count. He says that in tests, the laser scanner was never wrong. It also identified the malaria infection early, when treatment is important. The device is easy to carry and operates on battery power. It costs about $10,000 to $20,000 to make. Dr. Lopatko estimates that each laser beam scanner could test more than 200,000 people a year. He says that means the cost of testing would be less than 50 cents for each patient. An article describing the malaria testing device was published in the journal Proceedings of the National Academy of Sciences. For VOA Learning English, I'm Carolyn Persutti.
From VOA Learning English, this is the Health Report. A deaf and blind woman from Australia is the first person to make a telephone call using a device that turns speech into Braille. Braille uses raised dots on a surface that can be read by touching it. The technology is being tested in Australia and the U.S. One test involved a simple phone call between two sisters. Michelle Stevens is deaf and blind. Ms. Stevens says the Braille telephone will end years of feeling alone and apart from others. She is one of 5 Australians taking part in the new trials, or tests. Ms. Stevens' vision suffered damage because she was born prematurely, or born too soon. She lost her hearing from serious ear infections. The Braille telephone system, she said, will be a great help to her and others. Ms. Stevens told VOA's Phil Mercer that with future developments, the phone system might be able to give deaf-blind people more job opportunities. However, the phone system is expensive. It costs about $2,500. The phones work by transferring spoken words onto what is called a dynamic Braille display. The technology was developed in the U.S. Christopher Engelke is a director with the U.S. company Ultratech. Soon, he will carry out the U.S. trial. Mr. Engelke explains that a deaf person uses the phone just like any other phone. However, subtitles of what is said appear on the phone's touch screen. Mr. Engelke explains that vision-impaired people would listen as they can, speak with their own voice, and read what is being said to them from the braille bumps on the phone. In Australia alone, it is estimated there are 330,000 people who are deaf and blind. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. The World Health Organization says cervical cancer kills 250,000 women worldwide every year. WHO officials say 4 out of 5 of those women live in poor countries, like the West African nation of Burkina Faso. Doctors there are now using a simple, low-cost method to test for cervical cancer. They say the test can save thousands of lives every year. Wakuba Wajaogo directs the cervical cancer prevention program at a health clinic in the capital, Ouagadougou. He says cervical cancer has become the most common cancer among women in Burkina Faso. But he says finding and treating the cancer early has become much easier. Doctors there are using distilled white vinegar, a common cooking liquid, to help them see cancer cells. The vinegar can be bought at almost any market in Africa. The doctors use a small piece of cotton to place some vinegar on the opening of a woman's uterus. The liquid causes precancerous or cancerous cells to turn white. Dr. Stanislas Paul Nebe has been using the vinegar test since 2010. He says other tests are more costly and require sending cell samples to a laboratory. At a medical center in Ouagadougou, women pay $4 for the test and treatment for cells that show signs of cancer. Dr. Nebe says this is a good deal when one considers the high cost of radiology or medical operations to treat the disease. He says medical centers in rural villages are using the vinegar test. Burkina Faso does not yet have information on how many lives the test has saved. But doctors in India have said it cut cervical cancer deaths by 31% in a study of 150,000 women. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. Many people all over the world enjoy an alcoholic drink, such as wine or beer, during dinner. Sometimes people raise a glass of alcohol to celebrate a wedding or a birthday. And having drinks after work with friends and co-workers is called happy hour. All these situations are considered social drinking because they happen at social events. But when does social drinking become problem drinking? According to the World Health Organization, alcohol abuse kills 3.3 million people each year. The report also says alcohol use can increase the risk of developing more than 200 diseases, including some cancers. And it says alcohol abuse can put people at greater risk of infectious diseases. Shakar Saxena is a WHO official. She says the organization is concerned about drinking among young people under the age of 19. She says it is most concerned about what is called binge drinking, an extended period of heavy drinking. She says research found that 16% of drinkers over the age of 15 are binge drinkers. The WHO report also found that the highest rates of alcohol-linked deaths are in Europe. Finally, the report says less alcohol is used in Africa than in Europe, but it says the health effects are worse in Africa because of a lack of social support systems and health care. The WHO says countries can protect people from alcohol abuse. Possible measures include raising alcohol taxes and the legal drinking age. Controlling the marketing of alcoholic drinks could also reduce abuse problems. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Japan and Germany have the world's oldest populations, but neither country has enough trained healthcare workers to meet the needs of older adults. Now they are turning to Vietnam for help. This month, 100 young Vietnamese are going to Germany as part of a project to train what are called geriatric nurses to work in the European country. The trainees recently completed a 6-month language and culture class in Hanoi. They will spend the next 2 years in an occupational training program. If the trainees pass the final exam, they will be able to work in Germany as geriatric nurses for another 3 years. Germany is facing a crisis as low birth rates combine with a growing population of citizens who are living longer. About 20% of the population is over age 65, and that percentage is expected to continue rising. This is a problem that Japan also faces. Later this year, 150 Vietnamese candidates will go to Japan for 2 years of training at the country's hospitals. After that, they are expected to take the national nursing exam. Japan already trains nurses from the Philippines and Indonesia, but the healthcare system has been criticized for being too restrictive. All candidates must take the same exam, but it is very difficult for foreign applicants because few can speak the Japanese language. Many Japanese are opposed to foreigners working in some industries. Critics say foreign labor could lead to higher unemployment. But there is little opposition to foreign nurses. In Vietnam, there are not enough jobs for everyone who wants one. Most children are expected to care for their aging parents when they get old. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Bananas are often called the perfect food. The fruit provides lots of important vitamins and minerals. It can help fight depression and prevent muscle pain. Bananas also lower blood pressure and protect against heart attacks. And bananas taste great to most people. They add natural sweetness to baked goods and health drinks. Plus, bananas come in their own protective, biodegradable packaging. There have always been many reasons to eat bananas. And now, there is another. Bananas have a protein that might protect against viruses. Scientists are now trying to turn that protein into a drug. The protein is called banana lectin, or Banlec. Banlec attaches to sugar molecules and blocks viruses from entering cells. The team of researchers published their study in the journal Cell. They say Banlec might be used to make a drug that could treat a wide number of viruses. These include HIV, hepatitis, and influenza. David Markovitz of the University of Michigan in Ann Arbor was a leader of the study. He says that you cannot get the benefits of Banlec just by eating a banana. Stomach acids, he explains, will destroy the protein before it has a chance to fight infections in the body. Markovitz says researchers investigated the banana protein for its possible protectiveness against HIV. But they found that the protein fought off a number of viruses. At this point, Markovitz says there are no plans to test the Banlec protein on humans. He says they need to move forward cautiously to avoid doing any harm. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Could young blood be the answer to cheating death? It may sound like the story in a vampire movie, but now there is scientific research that supports the theory. U.S. scientists have discovered a protein in the blood in young mice that can undo some effects of aging in old mice. The same protein is present in human blood. 2 papers published in the journal Science discuss this protein called GDF11. Researchers at Harvard University said GDF11 improved the brain and muscle ability of older mice. This protein is found in high levels in the blood of young mice. In one experiment, the scientists increased the levels of GDF11 in aging mice by surgically connecting the blood flow systems of young mice to the old mice. Blood containing higher levels of GDF11 flowed among both groups. In another experiment, they injected the protein into old mice. The old mice formed new blood vessels. The animals' blood flow improved, and the aging process changed directions or reversed in every tissue the researchers observed. The scientists saw the greatest change in the old mice that shared blood flow with the young. Researcher Lee Rubin is a professor of stem cell research at Harvard's Stem Cell Institute. His team looked at the effect of GDF11 on brain tissue. He says the operation produced structural changes in the old brain, making it more like the young brain. Another scientist said that GDF11 repaired DNA damage linked to aging. There is growing hope that GDF11 might someday repair and renew unhealthy human hearts. For VOA Learning English, I'm Laurel Bowman.
Carolyn Persutti.
From VOA Learning English, this is the Health Report. Midwives help women have natural childbirths at home and in medical centers. A group of midwives in Los Angeles, California, is trying to train more minority women. They also want more women to give birth at home. Only 1% of babies in the United States are
From VOA Learning English, this is the Health Report. Researchers say an experimental vaccine has shown to be highly effective at preventing the deadly disease Ebola. The World Health Organization says that the vaccine has been 100% effective at tests performed in Guinea. The British medical journal Lancet has published early test results and announced that early results were so promising that everyone at risk received the vaccine immediately. The WHO's General Director, Margaret Chan, told reporters that scientists, doctors, and drug companies worked together on the vaccine. If proven effective, she said the vaccine is going to be a game changer. She said it will affect efforts to control the current Ebola outbreak and future outbreaks. For VOA Learning English, I'm Carolyn of the findings. Norway's foreign minister praised the effectiveness of the new vaccine, calling it the silver bullet against Ebola. Norway is one of the several countries involved in the testing. Ebola spread through West Africa last year. The disease killed more than 11,000 people, most of them in Liberia, Guinea, and Sierra Leone. Ebola is one of a number of highly dangerous viruses known as hemorrhagic fevers. They can affect many organs, damage blood vessels, and affect the body's ability to fight infection. There are hopes the new vaccine may be a success in fighting against all such diseases. The vaccine is known as VSV-EBOV. Beginning in March, it was tested on more than 4,000 people in Guinea. All of them had come into close contact with the Ebola virus. WHO officials